Roger Ray.
Thank you, Cathaoirleach, and thank you for making time for these statements, which are the first, I believe, on health in this new Dáil. The Government and I know Deputy Cullinan, are fully committed to a vision of a universal health and social care service where people have access to services based on need and not based on their ability to pay. The full implementation of Sláintecare remains one of the most significant reform programmes ever implemented by this state, and I'm so pleased that it's a collective effort in this House that is enabling that. We are doing so against the backdrop of the greatest investment ever in healthcare in Ireland, the largest health and social care workforce, and against the challenge of an increasing and ageing population. A healthy population is beneficial for society as a whole, and improving the health and well-being of the nation is a major priority for this government. As a result of the strong continuing investment in our health and social care services, as well as changes in behaviours, our people are living longer and healthier lives. Our life expectancy at birth is now 82.6. It's the 5th highest in the EU 27, behind Spain and Italy, who have lifestyle advantages and weather advantages that we can't compete with, I'm afraid. But we're the 5th highest in the EU 27. But the aim should not just be to live longer, but also to live healthier for longer. And Ireland's healthy life years at 65 is the 3rd highest in the EU. Ireland also has the highest self-perceived health status in the EU, with 80% of males and 79% of females rating their health as good or very good. And those figures point to a thriving population who in large part are enjoying good health. It is important for us to acknowledge this positive reality and recognise the massive contribution that our health and social care workforce makes to the lives of everyone in Ireland. And the Government is committed to further transforming how we deliver health and social care through the implementation of Sláintecare, and the programme for Government is to ensure that the right care is available at the right place and at the right time. We are prioritising increasing access, making sure that those who need care receive it and that the care that they receive is safe and of high quality. We are increasing capacity while expanding eligibility. The population of Ireland is increasing at an unprecedented rate. In the past decade, population has grown by 15%. The population of over 65s is growing at over twice that rate, with an increase of 37% or 220,000 people. By 2044, the number aged between 65 and 84 is projected to increase by over 65%, while those aged 85 and over will more than double. More people overall, as well as more older people, means more demand for our services, particularly in chronic disease management and long-term care. And that is why we have been investing in building our capacity, both in infrastructure and workforce. For many decades, we underinvested in our health and social care infrastructure. And we are now working hard to address this deficit and increase our capacity. Under this and the last programme for Government, significant public investment in healthcare infrastructure and capacity is continuing. Planning for future capacity requirements ensures that we are addressing longer-term challenges and preparing our health and social care service to be fit for the future. Infrastructure plays a vital role in delivering health services, and we need to ensure our assets, both physical and digital, are fit for purpose and that they help improve health outcomes and experiences for patients and those who give them care. We are committed through the programme for Government to deliver a significant programme of work through our capital programme, increasing capacity by between 4,000 and 5,000 new and refurbished inpatient hospital beds across the country, increasing ICU bed capacity by at least a further 100 beds, providing more community beds, building 4 new elective hospitals, establishing 6 surgical hubs in Dublin, in Cork, Dublin, 2 sites in Dublin, the first of which I was delighted to open in Mount Carmel 2 weeks ago, and Galway, Limerick and Waterford, and exploring the provision of an additional surgical hub for the North West in a timely manner. Expanding trauma services, including facilities in Dublin, Cork and Galway, and continuing to increase capacity and open more beds at UHL and across the Midwest, and take account of HIQA recommendations which are yet to come in that respect. Protecting diagnostic pathways and invest in infrastructure and equipment to meet target treatment times outlined in the National Cancer Strategy, and build a new National Maternity Hospital. This is a major infrastructural investment by the state for women's health, providing much needed facilities for women, girls and babies for generations to come. The new Children's Hospital, which I will be visiting tomorrow, will be an incredible state-of-the-art hospital and Ireland's first digital public hospital, providing 473 beds in total, 380 inpatient beds and 93 day beds. The the project, the build, is 95% complete against contract value. Once substantial completion is achieved, the hospital will be handed over to Children's Health Ireland for a substantial completion and operational commissioning period of about 6 to 9 months. What we're hoping, though, of course, is to have early access, and what we're expecting is early access, and for that work to begin in April. And can I be clear, I'm visiting the hospital tomorrow with the Minister for Health in Northern Ireland, Mike Nesbitt, and of course there is good work to develop a children's hospital in Belfast as well, and so I'm excited to speak to him about his project and what's happening in Northern Ireland, and of course to see about the completion of the hospital, which is a priority for everybody in this House. There has also been an unprecedented level of investment in the health service workforce in recent years. As of December 2024, there was 126,740 whole-time equivalent staff working in the Department of Health funded services. And that's an increase of 25% over 2020 numbers. And that represents an increase in our workforce, which is a positive development, but it's important now that that workforce growth is managed in an affordable and sustainable manner, and also that we get the best productivity that we can from everybody who is working in our health service, which I think is a reasonable expectation by the taxpayers and people of Ireland. One of the pressures that we all feel and that we must address is increasing capacity and access to acute hospital services by building infrastructure elsewhere. And what, of course, we want to do is reduce waiting times for access to healthcare services. And as Minister for Health, ensuring better access to healthcare in Ireland and reducing the time that patients are waiting for care in our acute hospitals is one of my highest priorities. And of course, time is what we must be focused on. Which would you rather, 100 people waiting 1 year for a treatment or 100,000 people waiting for 1 month? Of course you would prefer the latter, and we must focus our emphasis and our tests and our assessment must be based on waiting times, which are coming down, but which need to come down further. And of course our Sláinte care targets are of 10 and 12 weeks. The waiting list action plan for 2025, which I published earlier this month, is another milestone on that journey, and it sets out 4 key targets which are all focused on reducing hospital waiting times by the end of the year, including further reducing the proportion of longer waiters and average waiting times, as well as having 50% of patients waiting within the Sláinte care 10 and 12 week waiting time targets. Since the commencement of this waiting list action plan approach in 2021, genuine progress has been made in reducing waiting times in our acute hospital. For example, up to the end of 2024, we'd achieved approximately 25% reduction in the number of people on waiting lists waiting longer than the Sláinte care targets, which is 150,000 fewer people breaching those targets. Over the same time period, we've reduced the weighted average waiting time for outpatients from 12.8 months to 6.8 months. And through this year's action plan, we aim to further reduce the average waiting time for outpatients to 5.5 months by the end of this year. Reducing waiting times for care will bring a number of benefits from a patient perspective, obviously including improved outcomes and just a genuinely better experience of the health service and a person's experience of the difficulty that they're facing. The second point of access is, of course, access to urgent and emergency care, and in particular that most visible element of it, the trolley count that we see and people unacceptably waiting on trolleys to get access to our healthcare services. The number of patients waiting on trolleys at 8 a.m. in 2024 was down compared to 2023, in spite of increased attendances. But I have seen an important drift and an important drop in that very good work that was done between 2023 and 2024 in the last 8 weeks over the last period, and it's something that I'm determined to arrest that drift and turn it around. Our emergency departments experienced an 8% increase in the volume of attendances, equating to nearly 119,000 presentations, which was an 11% increase in attendances for 75 years and older patient cohort. But in that period, we achieved at that time a significant reduction in the cumulative daily 8 a.m. trolley count over 2024, with numbers down 11%, fewer older patients waiting for longer times, and we intend to try to reduce that further this year. But it is important to acknowledge that our emergency departments see over 5,000 patients a day, and the vast majority of patients who need a bed get a bed in a timely manner and do not spend an extended period waiting on the trolley. So this is happening while our healthcare service is also experiencing a significant increase in our demand for care. So what I would say on waiting lists and waiting times is, if our population is growing, 2 important points: if our population is growing and if people are getting a better service in our healthcare system, if they are getting better diagnostics and being referred for more procedures, I actually would like to see, logically, the number of people waiting for treatments increase as a consequence of population increase and as a consequence of being diagnosed and correctly referred for the number of treatments. However, what I would like to see is the time for all of those things coming down, and that is why we must focus on waiting times. I have got to arrest the drift that has happened into 2025 in terms of trolley numbers, and I've obviously placed a particular focus on the weekend spikes that we're seeing, and I will be updating the House as regularly as I can next after St. Patrick's Day on the rostering, the scheduling, and all of the services that are there to support people not being waiting on trolleys, which includes analysis of admissions, discharges, rostering, but also the broader community supports, the whole of region involvement that is necessary to make sure that people can be safely discharged as they need to be discharged. But there is a body of work there to improve on the good progress that was made last year, and indeed to get it back to where it had been. But there's also then access to community care, if I may say. As people live longer lives, they want to stay healthy and independent. Government policy is to support people living with dignity and independence in their own homes and communities for as long as possible for them to do that. And the Enhanced Community Care Programme is a transformative initiative under Sláinte Care, shifting healthcare delivery from hospitals to community settings, ensuring patients receive tailored treatment closer to home. And we want to strengthen primary care, general practice and integrated community services, again preventing unnecessary hospital referrals and admissions while enhancing patient outcomes. And again, this is consistent with Sláinte Care, getting the right care as close to home at the right time. Since its launch in 2020, that the ECC has expanded significantly with 2,000 additional healthcare staff, the establishment of 96 community health networks, and 50 of the planned 60 community specialist teams for older people and chronic disease. Last year, community specialist teams for older people had a total of 133,000 patient contacts, and a 35.1% increase over 2023. The focus of those teams is on prioritising complex and more frail patients, and the vast majority of those patients are discharged home as opposed to having to go to an acute hospital. Linked to the GP Chronic Disease Management Programme, the Community Specialist Team for Chronic Disease Management provides services for some of our most chronic diseases, respiratory, cardiology and diabetes. They've had over 354,000 patient contacts in 2024, which is a 28% increase in 2023. Significantly, the overall implementation and rollout of the Chronic Disease Management Programme has resulted in a 16% reduction in chronic disease hospital admissions between 2019 and 2023, significantly lower than the 3% reduction for all medical admissions. Also linked to this is GP access to community diagnostics, where we had over 280,000 scans completed last year. We have a mobile X-ray service providing services to those residing in nursing homes, community disability units and those in their own homes for whom an attendance for an X-ray in hospital would prove challenging. In 2024, 7,200 patients were provided with a mobile X-ray diagnosis through that services, and 95% of them were treated at home and did not require transfer to hospital, the majority of which were in nursing homes. The Community Intervention Team service prevents unnecessary hospital admission or attendance and facilitates early discharge of patients for whom that care is appropriate, providing access to nursing and home care support, usually from 8 a.m. to 9 p.m. 7 days a week. There are 23 of these operating nationwide, and again in 2024, their activity continued to go upwards with about a 16% increase on 2023. And that home support is an absolutely essential service for people to be able to live longer in their own homes and to live well in their own homes. At the moment, the state is supporting about 58,000 people to receive home support. And the overall budget for home support now stands at €838 million, which is an increase of 70% over 2020. And that allocation means that we can provide over 24 million home support and complex home support hours in 2024, which is more than we have ever done before. But while we are investing more in our health and social care services, it really is important that we see that investment used productively and as efficiently as possible. Since 2016, the budget for health has increased by over 82%, from 14 billion to 25 billion now in the budget for 2025. Expenditure on acute care has increased by more than 80% over 7 years, from 4.4 billion in 2016 to 8.1 billion in 2023. So it's a very, very, very significant increase in spending, but we must make sure that we are getting the best from that. And the Productivity and Savings Task Force, established in 12 months ago, is driving a programme of work designed to achieve savings and efficiencies across the HSE in order to optimise the use of health funding by delivering safe health services And I am really committed to making sure that that task force continues at work and that we all see the benefit on behalf of our taxpayers, on behalf of the taxpayers and people of Ireland, that we are meeting our savings targets and continuing to implement a range of productivity measures that maximise access to health. One of the most important reforms in recent years is the public-only consultant contract, which was implemented in March 2023, and over 2,700 consultants, 60% of our consultants are now in that contract. We now have 4,500 consultants, which is a very significant increase, and 60% are on that public-only contract. And the primary objective of that is to enable the move towards genuine universal healthcare, with public hospitals exclusively used for the treatment of public patients. A core objective of implementing this contract is to enhance the senior decision-maker presence on site, out of hours and at weekends, and ensure those senior decision makers are present and delivering patient care when demand is at its highest. It means that more patients are treated by consultants, being treated quicker and getting out of hospital quicker where appropriate. Under Sláintecare, funding has also as the House knows, this is an area where I have an area of particular focus. And forgive me for looking at my phone, but I want to show you something that is, I think, important this week related to digital health, which is under Sláintecare funding has significantly increased to expand digital health technologies. Across the health service, building cyber resilience and progress towards digital health records for patients. The health service now has an ambitious forward-looking digital pipeline to deliver on our vision for digital care 2024 to 2030 and its accompanying implementation roadmap, coupled with an appetite and momentum for change. This is something that I think everybody has been looking for a very long time. It will address a deficit of investment in technology to date and significantly impact, I think, on productivity for people working in the system and access to everybody trying to access health and social care services. This started just yesterday with the launch of the app, which is what I was trying to show you on my phone. And so this is my version of the app. And if you haven't downloaded it yet as health spokespeople and as members of Dáil Éireann, I would ask you to download it. You need a MyGov ID to do that. Not everybody has that to hand, but if you don't have it, please go and get one, because it is a fantastic app and it's an opportunity for people to be able to schedule appointments in the public system. It's starting with maternity patients. It started with a pilot in Cork with maternity patients where they could clearly see their antenatal appointments, their appointments throughout the system, both prior to having a baby and also some of the follow-up care. Every time I look away. It also then enables, so that was the prime, but it will enable us then to schedule appointments over time. There's a series of rollouts in relation to this. But right now, for example, you can see locally, find a GP wherever you happen to be. If you have an emergency in some other part of the country, where is the local urgent emergency care centre? Where is the primary care centre? What do you need? It also will enable you to track your medication. And so the idea is this will be a single point. Like if you can do your shopping, if you can do your banking, you really should be able to look after your own health on your own phone, on the technology that I think everybody in this House has. I can see, for example, on this, my flu and COVID-19 records, and I'm sort of horrified by the gap between my vaccination record, but I can see it, and I can track if I had a series of medications or if it was difficult for me. How many of our constituents do we know that are tracking their medications on paper? And this should make it dramatically easier for them. So the reason I picked that up is to show you and ask you to please download it. Go to the App Store, go to Google Play and download HSE Health App, and please do it. Because it's a big step forward in our electronic health record programme. That's the first step. Then we will have a shared care record, and then ultimately the electronic healthcare record. And I hope that this House will put me under great pressure to secure the funding to make sure that we get the funding for the electronic health record, because of course it's in everybody's interest that we do so. So I would like to get lots of PQs about how we are progressing with that. So please do put me under as much pressure as possible. Separately, I'd like to just mention the National Improving Patient Safety Outcomes. My department leads the direction of patient safety and policy legislation via the work of the National Patient Safety Office. This is something that I think is important to, the office is responsible for, notifiable incidents and open disclosure, but I'm particularly sensitive that this is something that's deeply relevant today with Portiuncula, and I would like just update the House that I met more families this week on Monday in Portiuncula who have been impacted by patient safety. You will see an over-indexation possibly in the programme for government on patient safety. It's very, very important to this government that we get on top of responding to patients in a timely and a caring way. For example, and making easier the experience of having a difficulty in hospital. One of the families that I spoke with in Portiuncula this week identified the experience. Some of the situations in Portiuncula were, appeared to be emergencies that have been responded to by the hospital. Others, are different types of cases. Let me not preempt the investigations and the analysis of the reports. But the experience is so important, not just the facts, but the experience. And one family, for example, told me about the experience of coming to Dublin their baby had been transferred to the Rotunda for cooling, which was a completely appropriate response in this case. But they described, if you've just had a baby and your baby has been appropriately taken for cooling and taken away from the mother, that is a traumatic experience to go through. That is a traumatic thing to go through. And they described the experience of coming to Dublin, and while it was all of the care was correct, it's the experience around the care. And so, for example, it would have made their lives easier to know that there was discounted parking available in the Spire, and it would have made their lives easier to know that you could get discounted food in the canteen, in the staff canteen downstairs. Little things. It would have made their lives easier, for example, to know that people don't wear sleeves in a neonatal intensive care unit, and that they would have felt more comfortable had they known that coming up. So yesterday I met the master of the Rotunda, Sean Daly, and I made these points to him and asked him to set up a dedicated liaison for anybody coming from anywhere around the country to just make that experience a little easier. This extraordinary family offered to share pictures of their little baby or of the cooling process itself, just to, as they said, take the edge off that terribly traumatic experience. So these are the sorts of, so anyway, the master of the Rotunda has already come back to me to say that he will implement those changes, that he will put together a practical care pack for somebody coming. I will ask the other maternity hospitals to do the same where that sort of cooling process is used. But it's the sort of gentle changes that are just a bit more compassionate and just a bit more understanding of the patient experience. And I would very much like if any deputy has any example of where we can make the patient experience, where things go wrong, just a little gentler and a little softer and a little kinder, a little bit more compassionate and a little perhaps more thoughtful by all of the parts of the state working together, then please do bring those examples to me, and I will do everything that I possibly can to make sure that they're implemented. Separately, on patient safety, obviously, HIQA are doing an important body of work, and look, I'm running out of time, so I know the House we will be dealing with those issues over time in any event. I think that if I could just summarise our health system more broadly as I come in as Minister for Health for the first time, every time I look at our public policy questions and our public policy challenges around health, I am struck by our very long life expectancy relative to our EU peers, our extremely good outcomes in care right across the spectrum, whether it's cardiac care, stroke care, cancer care. Our outcomes are extremely good when people are in the health system. And that is a good public policy process to have. That is a good public policy situation to be in. Where we struggle, and we all know this, is access to care. So access to diagnostics, access to treatment, and that is why a focus on waiting times is so important. That is why access to urgent and emergency care is so important. And I just want to say to members of this House, to whom I'm accountable, of course, that my focus is on improving access as much as I possibly can. So what that means is making sure that we get the funding and the process in place to deliver the remaining surgical hubs, the elective hospitals, the National Maternity Hospital, our digital health programme, to make what I genuinely hope can be a leap in the infrastructure for our healthcare system to try to keep as many people out of our acute hospitals as possible. You have heard some examples this evening and what we're trying to do in the community, whether it's enhanced community care, the community intervention schemes, to try to keep people away from acute hospitals in the first instance, to try to keep them at home rather than in hospitals for different types of care. But we do also have this body of people who should be getting surgical treatment in elective hospitals and in surgical hubs. And it is my intention to try to get the funding and make sure that we manage the delivery to make sure that we have those. Last week or the week before, I opened Mount Carmel facility, which is the first of 6 such facilities, and that will do about 11,000 small surgical procedures every year, whether it's carpal tunnel surgery, whether it's a pain relief medication that has to be done in a clinical setting. But it will also have 18,000 outpatient appointments, which is appropriate that people are not going to acute hospitals for outpatient appointments of that kind. But I also want to see outpatient clinics delivered by consultants in hospitals on Saturdays. That is what our public-only consultant contract enables us to do. That is the expectation that we should have for our healthcare system, and trying to use not just the infrastructure for better care outside of the acute hospital system, but also to make sure that we're getting the productivity that we expect of the people who are employed by our healthcare system, who are public servants, as we are public servants, to make sure that they are delivering for the people of Ireland. But I assure you that as Minister for Health, I will work every day to ensure that we are fully realising the benefits of the investment that Irish taxpayers, the very considerable investment that Irish taxpayers have put in to our healthcare system, that we are building on the outcomes that we already have, and that we are improving access for everybody in Ireland. Thank you.